Have you ever stood up in the middle of the night, shuffled toward the kitchen for a glass of water, and felt that tight, squeezing pain in your calf that made you stop mid-step and grab the wall for balance? And instead of thinking something might actually be wrong, you just whispered to yourself, "Well, I guess this is what 70 feels like," and kept it moving like nothing happened. Because let's be honest, once you cross 65, you almost expect pain to show up like an uninvited house guest who refuses to leave. And you don't want to be dramatic about it. You don't want to call your kids and worry them. You don't want to sit in some cold exam room while a young doctor who looks 12 years old tells you it's probably normal. So you shrug it off. Maybe rub some ointment on it. Maybe blame the weather. Maybe laugh it off at breakfast like it's just another badge of honor for surviving this long. But what if I told you that one very specific kind of leg pain, the kind that hits when you walk and fades when you rest, isn't just aging, isn't just stiffness, isn't just you being out of shape, but could actually be your body sounding an alarm so clear and loud that ignoring it is like ignoring smoke in your living room because you don't see flames yet? And I'm not saying that to scare you for no reason. I'm saying it because too many strong, independent, good-hearted people over 65 brush this off until brushing it off isn't an option anymore. And by then, the conversation in the hospital room isn't about stretching or better shoes or drinking more water. It's about blood flow, blockages, risk of heart attack, risk of stroke, sometimes even risk of losing a limb. And that's not me being dramatic. That's reality. The kind of reality nobody likes to talk about at family dinners. But it's there, quiet and patient, just like the disease itself. Because circulation problems don't usually explode into your life with fireworks. They creep in, subtle, sneaky, almost polite at first. A little cramp when you walk to the mailbox. A little heaviness when you climb the stairs. A weird cold feeling in one foot that doesn't quite match the other. And you tell yourself it's fine. You tell yourself you're just getting older. But aging by itself doesn't cause a predictable pattern of pain that shows up after a certain distance and disappears the second you sit down. That pattern means something. It means your muscles are asking for oxygen and not getting enough. It means the arteries that are supposed to deliver blood like reliable highways are narrowing, clogging up slowly over years with plaque you never saw building. And when you move, your legs demand more blood, but the supply can't keep up. So they cramp, they ache, they burn, they basically protest. And when you stop walking, the demand drops and the pain eases. And that relief can trick you into thinking nothing serious is happening. But that relief is temporary. It's like muting the alarm instead of fixing the fire. And I remember hearing about a man named Robert. 74, retired truck driver, proud, independent, never missed a day of work in his life, who started feeling calf pain every time he walked his dog around the block. Same spot, same distance, like clockwork, and he'd just stand there, pretending to check his phone until it passed. Because he didn't want neighbors asking questions, didn't want to feel weak. And weeks turned into months, and that pain got worse. And one day he noticed a small sore on his toe that wouldn't heal. It just sat there, stubborn, and his foot felt colder than the other one. And when he finally saw a doctor, the diagnosis was peripheral artery disease. Arteries in his legs narrowed significantly. And the doctor looked him straight in the eye and said, "You're lucky you came in now, because had he waited longer, the tissue might not have survived." And here's the part that hits hard. Peripheral artery disease in the legs often means similar blockages could be forming in the heart or brain. Same process, different location. So that little calf cramp isn't just about your calf. It can be a window into your overall cardiovascular health. And that's what most people don't realize. They separate leg pain from heart problems in their minds like they're two different stories. But it's one circulatory system, one network of vessels, one plumbing setup. And if there's rust building in one pipe, you better believe it might be building elsewhere too. And I know some of you listening are thinking, okay, but I have arthritis, or I've always had back issues. And sure, not all leg pain is vascular. Sometimes it's nerves, sometimes it's joints, sometimes it's muscles. But nerve pain often feels like tingling or shooting electricity and doesn't follow that clean walk-then-stop pattern. Arthritis usually aches more with use and stiffness, but doesn't consistently disappear the moment you rest in such a predictable way. And that's why pattern matters. Consistency matters. Paying attention matters. Because your body is smarter than you think. It sends signals in patterns. And when you're over 65, the stakes are higher. Not because you're fragile. You're not fragile. You've survived decades of life. You're tough. But because healing can be slower and complications can escalate faster if something serious is ignored. And here's another thing that doesn't get talked about enough. Sometimes the pain doesn't even show up at first. Sometimes it's just fatigue in the legs, like they run out of gas too quickly. Sometimes it's a subtle change in skin color. Maybe a pale or slightly bluish tone. Maybe the skin looks shiny or thin. Maybe hair stops growing on the lower legs. And that might sound cosmetic, but it's actually about blood supply. And if blood isn't reaching the skin properly, it definitely isn't reaching the deeper muscles properly either. And in more advanced cases, there can be pain even at rest, especially at night. A deep aching that forces you to dangle your leg off the side of the bed because gravity helps a bit more blood flow down. And if that's happening, that's serious. That's not a wait and see how it feels next week situation. That's a call your doctor now moment, because pain at rest can mean blood flow is critically reduced. And ignoring that is risky in a way that's hard to overstate, and I don't say that lightly. I say it because independence matters more than almost anything at this stage of life. The ability to walk into your own kitchen, drive yourself to the store, travel, visit friends, stand at family gatherings without needing constant support. That freedom is priceless, and circulation is a big part of protecting that freedom. And here's the hopeful side of this story, because there is one. When caught early, peripheral artery disease can often be managed effectively. Lifestyle changes can slow or even partially reverse progression. Medications can improve blood flow, structured walking programs, yes, walking. Ironically, the very thing that triggers the pain can actually stimulate the body to develop new small blood vessels over time. Collateral circulation, it's called. And that's the body adapting, fighting back. And it's pretty amazing that even at 70 or 80, the body still wants to heal. Still tries to compensate, but it needs cooperation. It needs you to pay attention instead of dismissing every signal as just old age. Because aging doesn't mean ignoring warning signs. Aging means being wiser about them. And wisdom sometimes means swallowing pride and making that appointment. Even if you feel silly, even if the pain comes and goes, even if part of you hopes it's nothing. Because if it is nothing, great, you get peace of mind. And if it's something, you caught it before it caught you off guard. And that's strength, not weakness. And if you've been feeling that pattern of pain, that cramp after a block, that ache after 10 minutes of walking that fades with rest, don't panic. Just don't ignore it. Talk to a healthcare professional. Ask about a simple ankle brachial index test where they compare blood pressure in your ankle and arm to check circulation. It's non-invasive, straightforward, and it can reveal a lot. And I'm telling you all this not to make you anxious, but to make you aware, because awareness is power. And too many people lose options because they waited too long thinking they were being tough. And toughness is admirable. But smart toughness is better. The kind that says I value my mobility too much to gamble with it. The kind that says I've still got places to go, people to see, moments to experience. And I'm not letting a silent circulation issue steal that from me without a fight. And if any part of this sounds familiar, if you felt that specific walk-induced leg pain and brushed it aside, maybe today is the day you stop brushing and start listening. Because your body whispers before it screams. And the whisper in this case might just be coming from your calf. And here's the thing nobody really prepares you for when you step into your late 60s and 70s. It's not just about adding years to your life. It's about protecting the quality of those years. And quality is deeply connected to movement. Because movement is freedom. It's dignity. It's being able to say, I got this, without having to ask for help every 5 minutes. And when leg pain starts interfering with that, especially the kind that predictably shows up with walking and disappears with rest, it's not random, it's physiology, it's circulation. It's arteries that may be narrowing from years of cholesterol buildup, high blood pressure, smoking history, diabetes, or even just genetics you never asked for. And maybe you quit smoking 20 years ago. Maybe you've been managing your blood sugar pretty well. Maybe you feel like you did your part and this shouldn't be happening, and that frustration is real. But the body doesn't always follow our sense of fairness. It follows biology. And biology says plaque can accumulate silently over decades, narrowing arteries gradually until one day the demand for oxygen during a simple walk exceeds supply, and your muscles respond with pain. And that pain is information, valuable information. And if you respond early, you often have options. Sometimes it's medication to thin the blood slightly or improve vessel dilation. Sometimes it's cholesterol management to stabilize plaque. Sometimes it's supervised exercise therapy that gradually extends how far you can walk before pain sets in, retraining the body to be more efficient. And in more advanced cases, there are minimally invasive procedures to open blocked arteries, like angioplasty, where a tiny balloon widens the vessel, or stents that help keep it open. And these interventions can dramatically improve quality of life when done at the right time. But timing matters, because if circulation drops too low for too long, tissues can suffer permanent damage. Wounds can form on toes or heels and refuse to heal because blood isn't delivering nutrients and immune cells effectively. Infections can take hold more easily, especially if diabetes is in the picture. And that's when the situation escalates fast, sometimes shockingly fast. And nobody wakes up planning to face something like amputation. It creeps in through months or years of subtle warning signs that were rationalized away. And I know rationalizing is human. It's what we do to protect ourselves from fear. We downplay symptoms because the alternative feels overwhelming. But information handled early is far less overwhelming than crisis handled late. And there's also an emotional layer to this that doesn't get enough respect. Because for many people over 65, admitting something might be wrong feels like admitting vulnerability. And vulnerability can feel uncomfortable after a lifetime of being the provider, the protector, the strong one. But there's a quiet kind of courage in saying, something feels off, and I'm going to check it out. That's not weakness. That's leadership over your own health. And if you have grandkids who run toward you at family gatherings, or hobbies you love, or trips you still want to take, protecting your legs is part of protecting those experiences. And let's clear up one more misconception. Some people think if they're not in severe agony, it can't be serious. But peripheral artery disease often starts with mild to moderate discomfort, manageable enough to ignore, and that's why it's dangerous. Because it doesn't always demand attention loudly at first. It negotiates, it whispers, it compromises. And by the time it shouts, the situation can be complicated. So pay attention to patterns. Pay attention to consistency. If every time you walk a certain distance, you feel that cramp, and every time you rest, it eases, that repetition is not coincidence. It's cause and effect. And if you've noticed your foot feels colder than the other, or pulses in your ankle seem weaker, Or you've developed numbness along with that exertional pain. Those are more pieces of the puzzle. And yes, sometimes tests will show it's mild. Sometimes lifestyle adjustments will be enough. And that's a win. That's catching it before it grows teeth. And maybe this conversation feels heavy. Maybe it even makes you a little uneasy. But sometimes a little discomfort in a conversation prevents a lot of discomfort in real life. And I'd rather you feel slightly unsettled now and take action than feel blindsided later, wishing someone had spelled it out clearly. And if you're listening to this and thinking about your spouse, your older brother, your neighbor who always complains about calf cramps on walks but laughs it off, maybe share this with them, because pride can be stubborn. And sometimes hearing it from someone else makes it sink in differently. And at the end of the day, this isn't about fear. It's about stewardship of your own body. You've taken care of so many responsibilities over the decades. Jobs, family, bills, crises, celebrations. Now it's about taking care of the vessel that carried you through all of it. And that includes not dismissing a very specific leg pain pattern as just getting old, because aging is natural. But preventable complications from ignored circulation problems are not something you have to accept as inevitable. And if you take one thing away from this, let it be this simple idea. Pain that predictably appears with walking and disappears with rest after 65 deserves attention, not dismissal, and making one appointment. Asking one question, getting one simple test could be the move that preserves your independence for years to come. And that's worth a little inconvenience, worth a little humility, worth stepping out of denial and into action, because you are not done yet. Your story is still being written, and your legs, those loyal, hard-working legs, deserve a fighting chance to keep carrying you forward.